Welcome to another On the Sofa with Kevin. One of the things I'd like to point out about this video series is that it's not sponsored or promoted by any of the companies or people with whom we do the videos. This month I am speaking to David Foster, Managing Director of Braemar Finance. In my opinion, having worked with hundreds of practices across the UK and Ireland who have used the services of many finance providers, Braemar consistently offer an excellent service and we're very happy to refer clients to them. Good afternoon, David.
Good afternoon to you, Kevin.
So 0% finance, if you're not familiar with it, means that patients don't have to pay the full cost of treatment at the time of delivery. It means that they can spread the costs over a certain period of time, which is great if somebody really wants a treatment, really needs a treatment, and just don't have the cash at that particular time. So in my mind, I'm confused as to why somebody wouldn't want to offer it, David, but that's where I'm going to hand it over to you. Why should a practice offer 0% finance?
It's an added service which many dental practices actually confuse with the word sales. Because they're uncomfortable with the word sales sometimes, a conflict in their professionalism. However, what 0% finance does, or finance in general, because we can offer an unsubsidised finance product as well, is confirm the affordability of the clinical treatment plan which has been identified as exactly what the client is actually looking for. And if you can provide the patient with exactly how they want to look, convince them that that's what they want to do, and then make the connection to prove that you've actually gone that extra mile to make it affordable for them, then not only do you get more treatment plans being taken up in their entirety, but you also get very happy patients who then refer you on to many of their friends. Because the referral is, they've made me look this good, but they also help me spread the cost. Well, the amount of treatment plans that are taken up as opposed to suggested is huge, and we've got anecdotal evidence of that from many practices. Once they get into the habit of it, the patients do love the treatment finance. The practice team love it as well, because again, one of the benefits at front desk is they don't have to ask for deposits, they don't have to ask for continually staged payments as they come in, and nor do they have to chase anybody up for non-payment once the last course of treatment has been done. That's all down to the finance company. So I think it's a question of more patients definitely take up the treatment plans that are suggested to them. You've got very happy patients then who look like they want to look, and at the same time you've then made them afford that particular look that they've always aspired to and never thought they could afford.
So I'm sold on 0% patient finance. The clients of mine, the practice owners, are sold on 0% patient finance as well. There's a number of providers. Why should they go to Braemar?
Well, Braemar Finance is a long-established link with the dental marketplace. It's still our biggest marketplace by far within the professions that we provide facilities for. And I established Braemar in 1992. The whole reason for establishing Braemar at that stage, which was a big move obviously, was because we didn't feel that the providers at that time did indeed put clients first. And I'd like to think that our reputation and the fact that we're still going after all these years does indicate that we do provide a service, and we try and back that up as much as we can. When we started providing facilities for patient finance, it was a paper-based system. It was 9 years ago, and some practices still have to be dragged kicking and screaming away from the bits of paper and fax machines. But we've now researched the market and found a fantastic IT platform provider, which means that we now offer a 24/7 application process. We can offer it depending on what suits the practice best at point of sale, within the practice itself, the application can be done, or alternatively you can supply a link to the client. They can go home and do it in the comfort of their own home. It will be, once the application process is done, which takes 2 or 3 minutes, it's an instant response, so it's a yes, or, and I think we're unique in the marketplace here, we don't give a decline straight away, we give a refer. If it's a refer, which means that we need a second look at it, it means that it's referred to a human being on the next working day. So you'll never get a decline where it's only the computer who said no. It means that with the computers flagged up an issue and a human set of eyes has had a look at it and confirmed a decline, because sadly we can't accept them all. But that's just an illustration of the levels we will go to make sure that we're covering as many bases as we can and having as high an acceptance rate as we possibly can. And then one final point I would make, Kevin, is that we are not a broker. We're a direct provider, which means that we've got an in-house team. We provide the money to back the whole process up, and there's always a point of contact at the Braemar office for any service issues that may occur, additional training required, or indeed any queries. And that happens to be right from the word go. If someone is looking to set up, they would almost certainly need to apply to the FCA for limited permission, and we can guide them through that, talk them through the application form if needs be over the phone, just to make sure that everybody's comfortable and happy enough with the process.
And that's actually one of the reasons that I happily refer clients onto Braemar. It's the personal touch, because it's finance primarily is anonymous. It's something that less and less companies now actually have a personal involvement with. But the entire team, Gail, Bob, the Steves, everybody is very much so hands-on with the practice. Who's your favourite team member?
My favourite.
Should I stop you before you get yourself into trouble?
Not at all, because there isn't one in particular, but the favourite team members probably are not the superstar sales team, but the sales support team back up in our office in Dundonald, because the sales team would be the first to admit that without them, their job would be a hell of a lot more difficult. And the practices indeed, generally speaking, will have more contact with the sales support team, Leslie, Ian, and the rest of the team up in Dundonald. We have 24 up there, so it's too long to list all the names. But they'll develop one-to-one relationships with them on an ongoing basis, and that will be the regular point of contact.
David, thank you very much for coming along on the sofa this afternoon. And I would suggest we go for a beer, but we'd sound like 2/3 of a joke if both of us start to walk into a pub. So thank you very much for coming along this afternoon.
That's quite all right. Besides, I know you never carry a wallet anyway. And I'm a Scotsman, so I'm not buying.